October is Breast Cancer Awareness Month, and it's a focus every year, and we'll continue that this year as well. Why? Because it is easily treatable if detected early enough as well. Surgery, of course, does become a big part of this. It also becomes a scar for life, if that's how far it goes. Dr. Phumudzo Ndwambi is a special interest in breast surgery as well. She's been very kind to come in and join us on NewsLink this morning. Doctor, good to have you with us on eNCA. We'll talk about the importance of Breast Cancer Awareness Month and the examination, because I feel it is one of those months, and tell me if I'm wrong, that actually does get a lot of attention and actually does get a lot of results because of that attention. Absolutely.
It is absolutely the month where we focus on breast cancer, and thank goodness for that, because like you said, it is one of the commonest cancers and very easily treatable if detected early. But it's something we should focus on the whole year, but I'm glad that October is a month just dedicated to that.
And we're going to get into the dedication of the month and then some practical tips. Because you're a doctor, I'm going to take advantage. Free medical advice on the way for you. Don't go anywhere. But I want to just get a sense, if you don't mind me asking, why the special interest in this? I mean, any doctor who goes into any sort of oncology work is very special. But what's your special interest in this?
So I'm trained as a general surgeon, and there isn't a specific breast fellowship in this country. All over the world, there are fellowships in breast and endocrine surgery. And so to be a breast surgeon in this country, you actually have to decide that you're going to take interest and just do that as a subdivision of general surgery, unlike perhaps a trauma surgeon or perhaps a vascular surgeon. And so my special interest is based on my background. I had a mother who had breast cancer, and she was a survivor for about 18 years. And so I grew up in a breast cancer household. And when I was training, I spent a lot of time in the breast unit at Chris Hani Baragwanath, and that's where I absolutely fell in love with it. But it's also very satisfying because it is treatable, the women feel empowered, and they do so well. And I just wanted to be a part of that experience.
It's such common knowledge these days for breast examinations and breast cancer. I don't know if there actually was much of a stigma back in the day. I'll tell you why I say a slight stigma, because as a guy, I feel that there's still a stigma around, for example, prostate cancer. It's something that guys just don't want to talk about. If it's not there, we're going to ostrich. It's not really going to happen until it's too late. Breast cancer is very mainstream, which is actually a good thing, isn't it? Because there's no shame in going to get yourself checked out.
And I think we've come a long way to destigmatize. I think there was a bit of a taboo in the earlier years, and I think it's because both those parts you're talking about, the prostate, the breast, are sensitive areas. You know, the breast is a sexual and a reproductive organ, and it is also in a way, women identify themselves sometimes by their femininity and by how they look, and it's something that you can easily see even under when someone is wearing clothes. And so I think people talking about that part of their life was quite sensitive, but I think, you know, mainstream media has broken that taboo, and now it's something that is very much encouraged, you know, to own it and to self-examine, to go get yourself checked out, and it's something we're heading towards for the males with prostate as well.
Yeah, we're getting there, aren't we, with these PSA tests.
Absolutely.
It's just a blood test, gents. Go get it done. It's just a blood test. It's really not that big a deal anymore, unless there's something wrong, which hopefully there isn't as well. Mail and Guardian, top 200 young South Africans. This was, what, a couple of years ago, but still you got the accolade. What's great is you haven't stopped there. You're using that focus on you, but you're dispersing the focus on breast cancer. How are you still doing that?
I absolutely want to be a champion for breast cancer in this country. I absolutely want people to associate my name with the progress and the advancements we make in this country with breast cancer, with spreading the fact that in this country we have dedicated breast units, dedicated breast surgeons, our healthcare and the things we're doing to make our survival rate equal to the rest of the world are phenomenal. And so since then, I have dedicated most of my work to working at the Chris Hani Baragwanath breast unit. I have my own private practice. I do a lot of advocacy for women to find the healthcare that they need, whether it's in state or whether it's in private. I do a lot of work to spread the message around what you can do about getting yourself tested before finding out you've got breast cancer, the genetics around it, etc. And so I think I spend a lot of my days just talking about it, spreading the word and trying to get people treated and cured.
Now, what you don't have, apparently, is a personal life, apart from working at a hospital, plus your own clinic, plus your own practice and everything else. But this is why the country needs people like you. I want to talk about the examination in a second, but I want to get a sense, because you mentioned Chris Hani Baragwanath Academic Hospital, one of the biggest and probably most important training hospitals.
Absolutely.
As far as, or any kind of medicine, in this case, breast cancer awareness as well. How concerned are you, or should we be, when you talk public versus private? Is there a difference between the healthcare, between the two of them? We often hear it's, if you've got a cancer, you don't want to be going to a public hospital. You want to have medical aid and go to private. What do you make of a comment like that?
The standard of care in the state sector and the standard of care in the private sector is the same in terms of the standard of the doctor you'll get, the standard of operation you'll get, you know. The only difference is resource management, because the volumes are different. And so whereas when you come to see me by appointment at my private practice at 9:30, you'll see me at 9:30. If you come to see me at Barra, you might wait 4 hours. Right. But the standard of care is still phenomenal. We don't have a waiting time at Barra. So if I diagnose you with a cancer, all your workup happens almost immediately, to the point where you might even get your surgery within a couple of days, which is the same, you know, in private practice. And for me, that just speaks to the fact that there doesn't have to be a difference. And if resources are managed properly and staff are dedicated, we can get the same standard. The only difference is your choice, perhaps, of surgeon in private versus state, your choice of date, perhaps, but otherwise the standard is absolutely the same.
I wanted to make sure that we understood that when it comes to especially cancer care, there is no difference in the care at all. Can we talk about another misconception, which I picked up over the years, that anybody under the age of 40 can't get breast cancer? It's false. It's true. It's not true, is it?
It's absolutely false. And in fact, it's devastating that what we are now seeing in our own clinic at Barra is a lot of the under 40s. I mean, we have 21-year-olds that we've diagnosed with breast cancer, unfortunately. Most of those obviously have predispositions and higher risk factors, such as genetic mutations. But yes, we do have many, many patients under 40. And so we are encouraging that come get yourself checked out, even if you're young, especially once you hit about 25 years of age. We do encourage that any lump, any nipple discharge, any asymmetry, any skin changes, don't think, no, surely it's a disease of the grannies.
Yeah, it's not an old person's
disease. It's not an old person's disease at all. And those young patients are the ones that actually do poorly because it's more aggressive in that age group. And so please, we encourage all women 25 and above, and even young women, start practicing now. Get yourself checked out. We're available for all ages.
What is the efficacy really of a self-examination? I imagine if you're a medical expert and you do a self-examination, you know exactly what you're looking for. You know what you're feeling. You know what it should be. But someone watching at home is going, well, maybe I should do an examination. We're not trained. We don't know what we're looking at. It could be nothing. We could feel a bump and go into a complete panic.
Absolutely. It's so interesting you say that, because even myself, as I train my medical students, I actually realize it's a very difficult concept to train even medical professionals. And so it isn't very efficacious. But if you know your body and if you examine yourself enough, the minute there's a change, you're likely to recognize it or realize it earlier than if you haven't examined yourself. So for that purpose, I'd say absolutely examine yourselves, but the best way to do it is to come and have your triple assessment done by a medical professional such as myself.
A triple assessment?
Triple assessment is what we call it.
Okay, triple assessment. I want to leave this as a last question as well, because I want to make sure that we're getting rid of any kind of stereotypes and cliches and stigmas. Doctor, while I have you with me, there are certain kinds of cancer, and again, I could be asking the most ridiculously inaccurate medical question. There are certain kinds of cancers caused by things. Lung cancer, generally associated with smoking, and can generally be avoided if you just don't smoke. What is it about breast cancer? Is it a predisposition? Is it a genetic thing? Is there something anyone watching can change in diet or fitness that can help prevent breast cancer? We
stratify the risk factors in terms of high, intermediate, and low. The highest risk factors being a woman in and of itself, just because of your physique, your makeup, and your hormonal subtyping makes you predisposed. Having a family history, which becomes a surrogate for testing for genetics, absolutely makes you a higher risk factor. Having had previous radiation as a child, or having had previous cancers before, because sometimes cancers work in like groups and what we call syndromes, and so things like that are the highest risk factor. And then lifestyle and environmental factors, pollutants, smoking, not exercising enough, having a higher fatty diet are more on the lower risk factors, and obviously they do help if you change your diet to a more healthier lifestyle to circumvent, but they're not preventative as such. And then sort of intermediate things such as taking the oral contraceptive for a longer period of time, those are kind of intermediate risk factors. All of those aren't causes of breast cancer, don't get me wrong. They just put you at risk in different varying levels.
Right. And I will leave this as a last question as well, because we're here destroying cliches and stereotypes. I've got one more for you as well. All the gentlemen, are you ready? Men can get breast cancer.
Absolutely, men can have breast cancer. We have men currently in our ward right now with breast cancer, men who's done so well. They don't advocate enough for each other. You know, when you go on these walks and when you see the breast cancer survivors, it's always the face of a woman. And I think men who've had breast cancer need to come and tell their story, because they don't talk about it enough, they do badly. They don't have enough breast tissue, and so it spreads faster in them. They don't talk about it because they think that the breast is a female organ as opposed to just an organ on a human being. And so men can absolutely get breast cancer. Men need to start talking about it more and talking to each other more and encouraging each other to come get checked out.
Nothing wrong with married couples talking to each other about it
Absolutely.
as well. In fact, before lunch, have an awkward Sunday lunch, ask about each other's breasts. It's a good thing to have. Doctor, thank you very much for coming in. Wonderful discussion. Specialist surgeon, Dr. Phumudzo Ndwambi, as we look at October being Breast Cancer Awareness Month. It is so easily treatable. It's not to downplay the disease, not at all, but it is so easily treatable. It's one of those, prevention is much better than cure. You've been given all the resources, you know where to go, you know what to ask for, and my thanks to Dr. Ndwambi coming in to join us this morning.